going to do the AP, lateral, medial oblique, intercondylar fossa, and a tangential. First, I'm going to start with my AP. I'm going to set my console to table bucky. It's going to be a 70 kV, and for the norm, it's usually 8 mats, but it can range from 6 to like a smaller adult to maybe 12. Next, I'm going to get my cassette. Here, I'm going to use a 10 by 12, put it lengthwise. Next, I'm going to detent my tube to the table. Make sure it's lined up to the tray. So this is detented 40 SID to the table, and we are ready to get my patient. Okay, I'm ready to go get my patient. He was changing into his gown, so I'm going to go grab him. Hello, Mr. Villa. Hello.
Hi.
Can you please confirm your first name and date of birth?
Pancho Villa, May 5th, 88.
Perfect. And what brings you in today?
I just got shot on my leg,
Oh, my. Okay. On your right leg?
on my right knee.
Can you go to take a seat? You're probably in pain.
A lot.
Is there any way you could be pregnant?
Come on.
Take that as a no? All right.
Of course not.
All right. Okay. So first I'm going to shield my patient. My tube is already aligned with my bucky. My cassette lengthwise. Raising the table to 40 SID. Okay. Now I'm going to float the table for the central ray to be perpendicular, just half an inch below the patella's apex. Okay, so we're ready to do the first EP. Don't forget your marker. Ready? Beep. Okay. Next, I'm going to do the oblique, still in the table bucky. I'm going to run this film. Put another set in the bucky. It's already lined up, so all you got to do now is, sir, can you just rotate your knee internally a little bit? Rotating the entire leg, not just the foot. So the patella is going to be inwards. Same thing, your central ray is going to be half inch below the apex of the patella. Beep. Okay, take this cassette out, and now I'm going to go run this and see how they came out. And now we're going to do our lateral, so unlike the PA, which is perpendicular, and then the oblique, which is 45-degree turn, now we're going to turn the patient completely to be on the side. So go ahead and turn on your right side. We're going to have his affected knee bent 20 to 30 degrees, and then the front one is just going to be in front of it, out of the way. For the lateral knee, we have the epicondyle perpendicular to the cassette. We're also going to angle our tube about 5 to 7 degrees to balance. Okay. We're also going to angle and make sure that our bucky lines up to it. Then I'll float my tube, and it's going to be about 1 inch below the medial condyle. Next, don't forget to put your marker. This is the right leg. Okay, so it's centered, and we're ready to do an exposure. This one is going to be just a little bit higher, just because the thickness and the density is just a little thicker than the other one. So I'll go up maybe to about 10 mass. So don't move. Ready? Beep. Okay. Take this out and go run this film. Okay. Now we're going to do the intercondylar fossa, which consists of our Camp Coventry method. So this is going to look for the intercondylar fossa right here in the back of the knee. So I have my film. It's tabletop. Go ahead and raise this up. The patient is already prone because we're going to go a PA. get your marker. So I'm centering the knee, and I have this foot elevated. It's bent about 40 to 50 degrees. Then I'm going to have my two and make it parallel to the lower axis of the leg. So it'll be about 40 degrees. So it's already 40 SID. So since it's parallel to the long axis, I just got to make sure the central ray goes into the mid knee joint here. Okay, and then I'm ready for my exposure. This one I'm going to change my exposure. It's going to be about the same, but go a little bit down. Probably do 70 at like 6 since it's tabletop. So don't move. Beep. Okay. Go and remove the cassette, and now I'm going to run it and check this film. Okay, now I checked my other films. Now next I'm going to do the last one, which is a tangential. This I'm going to use the Houston method. So I'm going to put the film, again, tabletop, under the knee. I'm going to bend the knee. It can be bent about 20 to up to 120 degrees. So this time, and make sure the tube is not warm when you're putting the foot on it. Now I'm going to make sure I put the central ray into the patellofemoral joint. So it's resting. Make sure also the tube is 45 degrees angled to the joint. So right now, making sure the central ray is to the joint. Foot is resting. And he is ready. So I will put my marker out of the field, of course. And now I'm going to shoot it. So this one's a tangential, so it's not going through a lot of density or tissue. So I'm going to go down in mass. So it'll be about 70 and 1 to 4 depending on the size of the patient. So don't move. Ready? Beep. Okay. So he's all done. I'm going to take this film, have all 5 of my views, and I'm going to check them all and see how they came out. So I have ran all my films here, and here I'm pulling up the first one, which was the AP knee. To check for proper criteria of a good knee x-ray is first my proper collimation here. I also have my marker on there. The patella is superimposed over the femur, so there's no rotation of the knee. We have also superimposition of the fibular head and the tibia, so just a little bit right there, as well as we have joint space right here between the fibula and the tibia. Also, just check around for the soft tissue, clear image, and we have the knee fully extended. Of course, if the patient couldn't extend all the way, then just let them do it as much as possible. So that's the proper criteria for a AP knee. So next we have our internal oblique knee. First, of course, we have good collimation around the knee as well as our marker. Also, you have your tibia fibula, well, the head of the fibula right here, just a little bit of a space. It's kind of hard to see on this one. Also, you can also see the lateral condyles of the femur and the tibia. Both tibial plateaus right here, nice open space. Also, mainly to know if this is oblique, you will see the shadow and the outline of your patella, and it's slightly inwards, not being superimposed on this side. So there's your proper medial oblique knee, so it's internally oblique 45 degrees. So here we have our lateral knee. You can see here that the patella, there's a nice space in between. Also, you have the space with your femur and your tibia, as well as your tibia and fibula have a separation right here approximately. Also, to check if it's a good knee x-ray laterally is to check if the condyles are superimposed. This is why we do that 5 to 7 degree angle. Also, we see the front of the tibia here, and that's pretty much it. As long as the collimation is good, we can see everything else that's needed for a diagnosis. So for our fourth view, we used the Kemp-Coventry method, which is to see the intercondylar fossa, which is this opening right here. We also have our patella up above with the axial projection. It moves it so it's not in the way or superimposed over the fossa. Also, we have this nice little gap right here in joint space between your femur and your tibia, as well as the clear bony structure here of your intercondylar eminence. Also a slight imposition of your fibula and tibia right here, proper collimation, and that is a good intercondylar fossa view. So our last image we took was the tangential, and for ours we used the Houston method, which had also the patient prone. So mainly on this one we want to see our patella here in profile, clearly seen, and also our patellofemoral joint space open right here is where we shot our central ray through to see a nice clear opening. Also we want to see our femoral condyles clearly right here. Also soft tissue of the femoral patella, which is right here around it. And pretty much that's it for our tangential view, and that's it.